All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. Your doctors are busy, your pharmacists are busy. They don't have time. For this hour, I do. So call in with those questions and those comments. I did want to say briefly, we mentioned hemp oil and all of that. You can come by Pruitt's Discount Pharmacy and get a sample for free. That's how confident I am in my stuff, that we're the only ones doing it. You can come and sample this for free. Everyone has sampled it, has bought it. You can also sample the hemp cream, one little small squirt, relief in your hands, your knees, or your hip. 1 minute or less, pain relief guaranteed. So call in, so come into the store and get a sample. This isn't something that we can ship to you. You must come into the store to use it. But we're gonna get right back into your calls here. So we've got Mary, welcome to Pharmacist on Call. How may we help you?
Yes, I'm calling about my husband. He has a lot of swelling in his foot.
Yes, ma'am.
And he's on fluid pills, and we do not use any salt.
Okay. Now, is he a heart failure patient?
No, he's had a heart attack about 6 years ago.
Okay, what other medications is he on?
Well, he's on medication for his heart, and he's on the fluid pills.
Okay.
And he's on Glamorad, and he's on Selenopril.
What is the dose of his fluid pill?
40 milligrams.
Was that furosemide?
Yes.
So is he taking that 1 or 2 times a day?
He's taking them once a day.
Oh, okay. Well, we have a lot of room to increase his dose to get more of that fluid off. So maybe you mentioned to his doctor, hey, I talked to my pharmacist, and he thinks maybe that we could increase this a little bit, to get more of the fluid off.
Okay.
Yeah, because you could go up to 80 milligrams twice a day. So he's nowhere near that. So he could even start out at 40 milligrams twice a day. Now, is he on fluid restriction to where he can only drink a certain amount of liquids during the day?
No, he isn't.
Okay. Yeah, so I just say, ask if the doctor will increase his dose on his fluid pill.
Okay. I appreciate that.
Yes, ma'am.
All right, thank you very much.
Okay, all right, thank you.
All right.
All right, bye-bye. Okay. Lucy, welcome to Pharmacist on Call. How may we help you?
Hello,
Lucy? Okay. All right, we lost Lucy there. Michael, welcome to Pharmacist on Call. How may we help you?
Yeah, am I on this time?
Oh, okay, yeah, I guess we are. We got our lines crossed there. How you doing?
Well, I want to give a shout out to Miss Thelma first and thank her for her son because he's very helpful and I appreciate what he does for the community. Listen, Dr. Pruitt,
yes, ma'am.
I've seen some things on TV about Prilosec and kidney damage. A couple years ago I asked you about that because I had heard that Prilosec they had linked to dementia. I've known a lot of women that, because of osteoporosis, they've been prescribed that osteoporosis drug, what is it, some sort of calcium supplement or something, and immediately they got a lot of pain in their stomach, started having stomach problems, and they went off of it, and a year later they were still having the same problems that came out of that, whatever that supplement they were giving them. And the doctor started giving them Prilosec. With women having more dementia than men, this really bothers me. I'm just wondering, have they found out, here's my question, I'm going to hang up, have they found out why the Prilosec and those kind of drugs cause kidney problems or damage, and have they found out why they're linking that to dementia too? I'll take your response offline if you care to answer. Thank you.
All right, sure, thank you. Okay, thank you, Lucy. Always calling in with the good questions. I'm clueless. I have no idea why it's linked to dementia, but my guess is it's probably messing with the dopamine in the brain. And women in particular are going to have, just because you have so many different hormones and things going on monthly, you all are probably going to be more prone to changes and fluctuations in hormones and brain neurotransmitters than your male counterparts. So you're probably going to be more sensitive to its effects if this is the case. But let me look into that for the next show. But very good question, Lucy. Let's see who we got here. Michael, welcome to Pharmacist on Call. May I help you? Hello?
This is Linda.
Linda, okay. How you doing?
Okay. I have low sodium, and I can't seem to keep it high enough. My legs and feet are just so tired all the time. I have trouble walking. And if I try to eat salt or a lot of soups and so forth, my blood pressure runs sky high. So, I'm kind of, I don't know what to do. To keep my sodium up.
How much salt are you trying to compensate with?
Well, actually, very little. In fact, I just cut it out just about.
Okay.
And
now, what has your doctor told you about this?
Well,
or did you even bother to ask
I don't think he really knows what to do.
Okay.
My sodium got down to 123, and I failed and everything. Went to the emergency room. And of course, they pumped saline, back in me and everything. But then it won't stay. Right now it's 130. And my legs and feet are still just real weak.
Let me think about that, because I think we probably need to supplement with something else in addition to the sodium to help it stay in there. But give me a call at the pharmacy tomorrow. The producer's gonna flash my information up, and be sure to give me a call and reference this conversation.
All right. Okay.
All right.
Thank you so much.
Yes, ma'am. All right. Thank you. Pharmacist on call. How may we help you? Hello? Pharmacist on call. How may we help you?
Hello, yes. This is Michelle.
Yes, ma'am.
Yes, I was calling. Is there anything natural that you can take for constipation instead of the over-counter medication?
Okay. Yes, ma'am. Water to start off with. How much water are you drinking? Michelle.
Yes.
How much water are you drinking?
I drink quite a bit of water.
Okay.
I drink quite a bit of water.
Are you under pain management where you're taking opiates?
Yes, I am. That's what I was just getting ready to say too.
Okay.
And I did read that can happen.
Yes, ma'am. Because what it does is it slows down your stomach, and it's in a place in your body called the sphincter of Oddi. All right. Did they put you on docusate sodium?
No.
Okay.
No.
I would recommend getting on that, and then we have something called CKLS, which I just ran out of, but it is a colon cleanser that keeps you pretty regular, and this stuff is a beast. So I would probably do it. So in addition to the water, make sure you use the docusate sodium. In fact, I think it's Doculac, so it's docusate plus Senna.
Is there some over the counter?
It is. You could find it anywhere, but it's Doculax but it's docusate sodium and Senecot.
Okay. Is it at your farm? You have it at your pharmacy?
I may have docusate only. I don't think I have the combination there. But give me a call. I'll take a look once I get there.
I would do better with the combination. Is that what you're saying?
No. Most patients just do the docusate by itself. But if it's severe, then I would recommend doing both. But if you just need to go, we have the docusate sodium at the pharmacy.
Oh, okay. All right. Thank you very much.
Yes, ma'am. All right. Thank you. All righty. Okay. Trying to keep up with y'all here. Pharmacist on call. How may we help you?
Yes, this is Mary.
Yes, ma'am.
I have neuropathy.
Okay.
And it's not from having sugar. I don't have sugar.
Okay.
I had cancer, and they said it's from the chemo and radiation I had.
Okay. Yes, ma'am.
Okay, I was wondering, do you know anything about the stem cell shot?
No, ma'am. Yeah, educate us.
You don't know nothing about it?
No, ma'am. Where are they putting it?
I guess in your my feet and my legs are numb.
Okay.
And I went to a doctor, and he said the only chance I have is them. The shot I just told you.
Yeah, I know what stem cell therapy is. Yeah, they're basically putting in new cells in your body to stimulate the growth of new cells.
Right. Well, is there anything else you can recommend?
Okay, so what are we trying to treat?
Neuropathy.
Oh, yes, ma'am. Glad you mentioned it. Pharmacist blend hemp oil. Yes, ma'am. This will help with the neuropathy.
Okay. Now, what milligram do you suggest?
Well, I just suggest half of a dropper full. Yeah, this is 250, so it's plenty. It's helped all of our patients.
Half of a dropper.
Yeah, and that's just to start with. You may not even need that much, but start with a half. If it's too much, then decrease. Or if it's not
I
enough.
don't know.
Ma'am?
Mine is pretty bad because my foot is already trying to start to turn.
Okay. Are you in the Nashville area?
I'm about 30 miles from Nashville.
Okay. Yeah, it's called, see it if you were close enough to come by and get a sample of it so you could see if it would be good for you.
Right. Now, I've been using that CBD oil.
Yes, ma'am.
And some man that sells it at a flea market told me to don't put it under my tongue no more, to put it on my feet. And I can tell that it does help a little, but a little is better than none.
That's
and
true.
I do take gabapentin for the neuropathy.
Okay.
But that's all.
What milligram?
6.
600?
600.
Okay. Yeah. I think the hemp oil will be good for you. If you like topical, we also have a hemp cream that you can rub on your leg. And this has helped a lot of people too. But I just prefer this because it goes all over the body, and whatever you have going on is going to address it.
Okay. Now, so you suggest the hemp oil
Yes, ma'am.
over the CBD or whatever?
Yes, ma'am, because hemp has CBD plus everything else in it. CBD is just one component.
Okay. But now this hemp helps everything.
Well, a lot. I won't say everything,
Well,
but it helps
you
a
know,
lot. Yes, ma'am.
Right. And you think that'll be better for my feet and stuff?
Yes, ma'am.
Because they are pretty numb.
Yes,
You
ma'am.
That's how bad I have it.
Yeah, just play around with a dose.
Okay. So you don't suggest the shot thing, but you don't know nothing about it, right?
No, I don't see anything wrong with the stem cell shot. It's probably going to be a nice insurance bill for them, but
Right.
yeah, I'm a proponent of stem cell therapy.
Okay.
Yeah.
Well, like you said, they're pretty pricey. I've been called about some, and they want the money up front, and who's got $6,000?
Then you may want to come on 30 minutes towards Nashville. And our smallest bottle runs $19.99, so it's a little bit cheaper than $6,000.
Oh, you're the only drugstore that sells this hemp oil?
No, well, we're the only drugstore that sells this brand. Yes, ma'am. That I stand behind.
Oh my God. Well, will you tell the address and all that on the...
Yes, ma'am. We're going to hold you hostage and make you watch the rest of the show, and then the producer is going to flash it up there at the end.
Okay. Okay, then. I appreciate it. And
Yes,
thank
ma'am.
you so much.
All right. Thank you for your call.
Thank you.
All righty. Bye-bye. All right, everyone, stay right there. We're up on another break. We'll be right back.